In recent months, South Africans have been dealt a major blow, particularly in their pockets, with increasing petrol and food prices and rocketing inflation. Now, these factors make it even more difficult for citizens to afford healthcare. Let's unpack the economic environment and the affordability of private healthcare. Damian McHugh is with Momentum Health Solutions. Damian, the reality is that the majority of South Africans are not on private healthcare, in fact, cannot afford private healthcare. And with the economy being the way that it is, more and more people are having to leave their private healthcare options.
Yes, Kathy, that's 100% true, and good evening to you and all your viewers. We have obviously seen some really difficult financial situations in South Africa over the last few years, and COVID has hindered many people's ability to keep even their income keeping up with inflation. So that is true. I think what we have to also realize is that medical schemes, just by their nature, probably only cover about 16% of South Africa's population. So only 4% of South Africa's population is uncovered by health insurance or medical schemes. And part of that is legislation. I mean, our Medical Schemes Act is from 1998. It's a long time ago. So that probably needs a bit of an update to encourage solutions to be able to cater for more South Africans, which is what we've tried to do some time ago, is to offer cover outside of the medical schemes world, just to make it more affordable so that South Africans in a difficult financial time are still able to afford access to private healthcare and private healthcare cover.
Does making it more affordable also means less coverage in terms of the benefits?
It does, unfortunately. There are certain benefits which we can't provide in a similar way to what would normally be provided in a medical scheme. But we've tried our best to provide the cover in a way which is suitable to that lower income earner. High income earners would often look for hospitalization cover first. Lower income earners often look for cover at a doctor and making sure that they can get access to medicines and optical and dental. So it's almost a bit of a different view and a different positioning of a solution, just to make sure that we're able to provide primary health care cover when it's needed most, particularly for people with their families. And from 189 Rand a month, benefits like that are sustainable, and we've been able to provide them in a very affordable way, for consumers.
When we look at the conversation around universal healthcare, Damian, this situation and a conversation like this, of course, brings that up because, again, this is why we need universal healthcare.
Absolutely. And that's going to take a little bit of time. So what we're suggesting is, enabling the public coffers, our taxpayer money to be able to stretch a little bit further. If, for example, the private healthcare sector was able to cover just double the number of people, we're only covering about 8 million people. So there's another 8 million people, and with that 8 million that we're covering is actually 3 million principals, if I can call it principal, families or principal members. Their whole families, equate to 8 million. There's another 8 million principal people who are formally employed that aren't covered by any form of health insurance. Now, if we could get those individuals into affordable solutions, what we do is we actually help government's money go further for the remaining people. And while we are progressing with universal health care, what happens is we're able to take a little bit of burden off the state. And we just think that this is not the full answer, but at least it's a step to achieving our answer of universal health care in South Africa, and alleviating some of that financial burden on a very strained South African economy as a whole. Anyway, it's not just the people in the economy like you and I and your viewers. It's also the South African tax base is smaller. Our ability to as a country to generate jobs, our GDP is low, and so on. So we also need to help government, and this is a great way we think that that private and public healthcare systems can work together for the benefit of both.
Damian McHugh, let's leave it there for this evening. He is with Momentum Health Solutions.